Does your hip pinch when you hit full depth on a squat? If the front of your hip hurts, this almost never has to do with tight hip flexors. It comes down to two things. Number one, hip internal rotation mobility, and number two, the strength to control that mobility. If we don't have both, the hip will run out of space and the front of the joint will feel that extra load. Let's start with how to improve that hip mobility. Now we're starting in a quadruped position, meaning down on your hands and knees. From here, we're going to twist one hip internally, meaning that the foot is now moving out to the side. Now what we'll do is we will push out, try and hold this for a few seconds as you continue to try and push farther, and then go all the way back, relax for a second, and repeat. Start with 20 reps on each side, and then try and compare before and after as to how far you can twist that leg. Try not to compensate by moving the spine or the pelvis. The motion should be isolated just to the hip. Now that we have stretched this motion, we want to now strengthen into the new mobility that we should have. In a side sitting position with the knee bent, you're going to try and do that same motion of internal rotation. Now what this looks like is I am just lifting my foot and lower leg up off the ground while keeping the knee on the ground. Depending on how tight your hip is, you'll need to change the angle of your body. You might need to go down onto your elbow or lay on your side because this will make it easier to do. But what we're doing here is we are lifting up. You're going to hold for a few seconds again. You should feel the muscles in the hip fatigue with this, and then relax. I would start with about 10 to 15 reps because this has the potential to make you sore if you're not used to moving this way. Something else that could be restricting that hip mobility is a tight joint capsule. Now, if this is the case, get down on your hands and knees again, put one leg out behind you, shift your weight back slightly, and then you're going to go straight to the side as far as you can, and you should feel a stretch in the outside or back of that hip as you stretch it. If you're finding this helpful, go ahead and hit that like button so other people can find it as well. Otherwise, let's move on to how we can now strengthen and stabilize the hip as we reach that full depth. The muscle groups we are focusing on are the lateral stabilizers, meaning the hip abductors, as well as the external rotators. Now get into a side plank position with your knees out in front of you. What we're going to do is do a side plank on the knee as we try and move through a squatting motion. Now, if you're doing it correctly, you'll feel this in the muscles on the outside of the hip, and they will fatigue fairly quickly, assuming you have weakness here. As you do this exercise, try and mimic the squat technique as best you can, meaning try not to collapse towards the floor throughout the motion because your hip and leg should stay out to the side when you're doing a squat. This will help us to better train these muscles for this specific position. Next, if we take a band and put that around our knees and then try and squat with this while maintaining tension on that band, this will cue those same muscle groups to fire as you move into the squat. This motion can actually be used as a test. So if when you put that band on your knees, your hip pain and that pinching sensation goes away, it means that you are simply lacking stability in the hip, and that by improving the strength in these muscles, stabilizing that hip is going to fix that pain long term. I hope you found that helpful. If you have any questions, just go ahead and put those in the comment section and I will try and answer them. Otherwise, if you want to learn a few exercises that I would do in addition to squatting so that you can have a more well-rounded lower body, go ahead and watch this video here.